Welcome to the Clinical Why, a nursing education channel focused on why symptoms occur, why labs change, and why we do what we do in the ER. I help nurses and students stop memorizing and start understanding. CO2 monitoring is usually preferred in patients such as those receiving PCA, during CPR, intubated patients, and respiratory failure, and so many others. That's why we are here to understand the why, so stick around. EtCO2 is an abbreviation for end-tidal carbon dioxide, and it refers to the amount of carbon dioxide a person exhales at the end of a breath. End-tidal CO2 physiologically indicates how effectively the lungs are exchanging gases and how well blood is circulating to the lungs. EtCO2 is measured using a technology called capnography, and normal readings are usually between 35 to 45 millimeters per mercury. Think of pulse oximetry as how full the oxygen tank is, and end-tidal CO2 as how well the body is actually using that oxygen, plus how well the body is perfusing. Changes in end-tidal CO2 can alert clinicians to respiratory or circulatory problems much earlier than oxygen saturation alone. For example, end-tidal CO2 can detect respiratory depression long before you see a drop in pulse ox. An increase in end-tidal CO2 usually indicates hyperventilation, and a decrease in end-tidal CO2 usually indicates hyperventilation or poor perfusion. When there is poor perfusion to the lungs, effective gas exchange cannot occur, leading to carbon dioxide buildup and abnormal end-tidal CO2 reading. This early warning allows for timely intervention and can prevent a patient's conditions from worsening. Thank you for watching. Subscribe and click the notification button to be notified whenever there is a new video.